Good afternoon and welcome everyone to today's edition of Black Health Trust. We are so happy that you chose to spend this time with us as we are going to talk about another of a series of conditions that are impacting our community disproportionately. And without further ado, I'll turn it over to our founder, Dr. Randall Maxey.
Thank you so much, Dr. Barbara Neighbor Stevens. We do have a quite interesting topic today. It was prompted by the fact that I had a visit by a patient of mine who's been my patient long term. And she happened to be a pastor with a radio show. And she presented to me saying that people had broken into her apartment and injected something into her, that she wraps herself in tinfoil to stop the radio waves that they send from a rooftop, and that the police and first responders follow her every place. And I was very concerned about that because she denies any problem with this. And I took it to my own personal psychiatrist who's going to present today on issues of mental health, including delusions, psychosis, and whatever his bright mind tells him to discuss. Dr. Ivan Walks is former medical director of the Department of Health in the city of Washington, D.C., which is currently being occupied by the federal government. He was a graduate of the University of California in LA, and he's very experienced in the issues of mental health. Dr. Walks, please address us.
Thank you very much, Dr. Maxey, and good afternoon, everyone. Um, this, as a psychiatrist, this topic, these topics are, of course, very near and dear to me. Not only did I work in Washington, D.C., but I was one of the mental health commissioners for the County of Los Angeles many, many years ago. And it's amazing how, I'll just use this as a preamble, how I think maybe the only calls I got were what we call NIMBY calls, not in my backyard. And not in my backyard was what everybody was really trying to say when we talked about putting mental health services in place in different parts of the county. Well, can you put it somewhere else? Can you put a clinic somewhere else? And so there is this stigma about mental health and mental health services that I want us to get into a little bit later. But Simon, if you could go ahead and start the slides, we'll see if I can get through them fairly quickly. I do want to leave time for some questions and for allowing us to talk together a little bit. So what Dr. Maxey asked me to talk about was exploring the factors behind mental health issues. So let's look at some of the factors. Next slide, please, Simon. So some key facts for us. When we start talking about mental health issues and mental health disorders, what are we talking about? Well, this is not a minor thing. If you look around the world, about nearly 10% of people live with a mental disorder. And mental disorders involve significant disturbances in thinking, emotional regulation, or behavior. And this is not just somebody feeling sad. We're talking about significant disturbances in things like thinking. I've never had a disturbance in my thinking that I'll admit to. And so it's very challenging when you're thinking differently than the rest of the world is thinking. And sometimes it can be overwhelming. One of the most important things is that effective prevention and treatment options do exist. And then the sad other side of that coin is that most people don't have access to effective care, which goes back to my earlier comment about mental health officials or behavioral health officials being told, no, I don't want those services here, put them somewhere else. Next slide, please, Simon. So what do mental health issues look like? If someone has a physical ailment, like I have a family member that has a loss of a limb, and it's pretty obvious that that person has a prosthetic limb. Now, so what do we see when somebody has a mental health issue? We tend to see a clinically significant disturbance or dysfunction in an individual's cognition, how their brain is working, their emotional regulation, trying to keep themselves in a place where they can behave appropriately, or frankly, their behavior. They're just not acting in a way that we think would be appropriate given where they are and what's going on. And this is typically associated with impairment or with distress in important areas of functioning. There's something that they can't do, or they're really distressed when they're trying to do a particular thing. Next slide, please, Simon. So there are main categories of these factors behind mental health issues: biological factors, psychological factors, social and environmental factors, and then there are other contributing factors. And we'll walk our way through these hopefully fairly quickly. Next one, please. Next slide, please. So biological factors. We talk a lot about things running in our family, and that's really genetics. The way that we look a lot runs in our family. You know, brothers and sisters sometimes look similar to the parents. So family history, I know certain folks who are really concerned about the way that they consume alcohol because they have a parent who was an alcoholic, or they're concerned about their own mental health because they have a parent or a grandparent who had a significant mental illness. Brain chemistry is part of that biological concern. Our neurotransmitters are imbalanced. People talk about, you may have a chemical imbalance or that kind of thing. They're talking about neurotransmitter imbalances, and serotonin and dopamine are two of the things that sometimes, to skip ahead a little bit, medications will try to adjust the available levels of some of those neurotransmitters because they're linked to depression, anxiety, schizophrenia, and other mental health concerns. So physical health conditions, chronic illnesses such as diabetes and heart disease can result in someone having that dysfunction I talked about earlier with respect to their mental health status. Neurological conditions, brain injuries, and then substance use, alcohol, drugs, prescribed medication. We tend to think about substance abuse as something that is really temporary. I'm going to go to the club, I'm going to drink, or I'm going to hang out with my friends and we're going to party. Maybe Dr. Maxey can help me understand why the definition of party when I was little was we're going to get together and we're going to put on some records and dance. And now the definition of party is we're going to get drunk and high. I don't know how that changed, but it's not always temporary that you get high and then you get all the way back to where you want to be, or quote unquote normal for you, for an individual. Next slide, please, Simon. So psychological factors, personality traits. We are quick to talk about somebody else's personality traits. At the same time, personality traits aren't necessarily a negative thing, but personality traits can contribute to our susceptibility or how we express whatever sort of mental health issue may be going on. So, and too much of anything is usually not good for you. Perfectionism is a good thing because you're trying to do everything correctly or properly, but perfectionism taken to extremes can really put a lot of stress and strain on an individual. Low self-esteem or pessimism can become personality traits as you are growing up, which is when your personality is developing, and you now have a psychological factor or maybe propensity to have some challenges because of how you are developing from some of the psychological issues, including coping skills. You may not have good stress management, or you may have unhealthy coping mechanisms because you've not learned how to cope with things. I have up on the slide here avoidance or aggression. There are a lot of folks that struggle with anger as a coping skill. Something happens to me, I'm going to strike out. I'm going to cuss you out. I'm going to do something that is on the aggression side. And particularly, young men of color wind up in trouble, legal trouble, with this issue of coping skills. Just because somebody says something to you, do you have to act a certain way? Well, maybe the answer is yes, because that's the only coping skill that I have. Um, Early childhood experiences are a big deal when it comes to psychological factors impacting mental health issues. Um, Childhood trauma, neglect, abuse, loss of a caregiver. We talk about childhood trauma and recognize that that can be a problem. Childhood neglect maybe isn't as easily or as readily recognized as a really significant issue for a psychological factor that may impact mental health issues later. And loss of a caregiver, neglect, you can see how those two can be linked if no one steps in. But even if someone steps in, loss of a parent, you wind up being raised by a grandparent, there's still a loss of that parent that is a big issue, no matter how good, um, no matter how much love, no matter what you get from someone else, the loss of a significant caregiver can really impact you down the road. Next slide, please, Simon. So social and environmental factors. This is really big for all of us who feel like we were doing okay until, right? A stressful life event, job loss, financial struggles, relationship problems, grief. These are things that we don't look for, that we don't choose, sometimes are not our fault, and they just wreak havoc on our feeling of peace or calm that really allows us to function at our best. Social isolation, a lot of folks struggle because there isn't anyone to talk about. Dr. Maxey always asks me what row I sit on in church. Well, one of the reasons that I try to get to church every Sunday is because it's good for me. I like people telling me they're happy to see me. I like people wanting to shake my hand and give me a hug. And for a lot of people, as our pastor and our bishop likes to say, they only get that at church. They may not have another person speaking to them person to person in a positive way during the course of the week. And this happens a lot as folks become elderly. Talking with some folks who are very, very elderly. Everybody they grew up with has died. Sometimes all their kids have died. And so social isolation is really, really a big deal. Socioeconomic status, I don't know how we expect anybody to be anything but sad when they're living in poverty, they have unstable housing, unsafe environments. I was talking with Pastor today after church about one of the guys who's very active in our men's group who was sitting at church yesterday under a tree because he didn't have any place to sleep or go. And things have gone very, very badly for him. And pride, the old saying, pride goeth before the fall, very hard for him to ask for help. And he had no place else to go. So he's sitting under a tree on the church grounds. Very, very challenging for a lot of folks to have life kind of fall apart under you. Cultural and societal pressures. There's stigma, there's discrimination, there are unrealistic expectations. Maybe you weren't built to go all the way through Harvard and Yale and get a PhD, or like Dr. Lawson, get a PhD, a MD, and a bunch of other initials after your name. Maybe you weren't built to do all of that. So if you have those kinds of expectations placed on you by others, it can be very difficult. And I don't know if I could have even grown up in today's world with all of the unrealistic expectations that hit people from either the general media or social media. Social media is, we talk a lot about helping young people to not deal with something I never heard of as a kid. I didn't know what cyberbullying was. I don't think it existed until a couple of decades ago. So there are new things. And when those of us who've been on the planet for a little while start talking to young people about, well, you need to ignore that. And it's a little more complicated then you need to ignore that when there's so much coming at you so fast. Next slide, please, Simon. Okay. Other contributing factors, sleep problems, chronic sleep deprivation. I used to work once upon a time, and my work started at 11 o'clock at night, and I got off work at 7:30 in the morning, just with just enough time to drive from Santa Monica down to USC to get to class so that I could try to get through college. I understand what sleep deprivation is. It is not fun. It does not put you in a good mood. It is a big challenge. And we have to know that our bodies aren't really designed to work 8 hours and then go to school for whatever long, or work 8 hours and then go to the second job for 8 hours. No matter what we're trying to get done, we have to respect our physiology, and sleep problems, chronic sleep deprivation will impact your mental health over some period of time. Ooh, diet and lifestyle, poor nutrition. Full disclosure, Dr. Maxey, I did stop at Burger King on the way home after church today. Should I have done it? No. But what am I going to say? Sometimes you just have to admit to people that you're doing wrong and you hope to do better. But this little bullet right here, poor nutrition, lack of physical activity, sometimes just staying inside, limited sunlight, vitamin D deficiency. There are so many reasons why we should do the right thing. One of the reasons is that almost always doing a lot of the wrong thing impacts our mental health. Work and academic pressures, burnout, overwork, toxic environments, home and work. You can have a horrible boss and then you can come home to a horrible home life. And so these sorts of pressures contribute. And don't think you can only have one of these things. You can have all of those bullets that on the last two slides hitting you at once. And if you're trying to manage all of that by yourself, good luck with that. It's just very difficult. We have to learn as individuals and as a community to open up a little bit and to find places where we can let people know that we're struggling, give them an opportunity to help. One of the things that I'm fond of saying is that when you don't ask for help, you don't get help, and you also deprive the person that you may have asked of an opportunity to bless you and bless themselves. Most humans, we tend to feel good when we help someone else. We tend to feel good when we are able to do something positive. And so it's not just I need help. It's also maybe there's an opportunity for you to give someone else a chance to pour some goodness into you and to support you. Other things we don't think about a lot with mental health stuff, and I'll get into this a little bit more later. Infections can cause you to have, the classic case of an elderly person with a urinary tract infection who gets a little goofy. Yes, that is the medical scientific term, Dr. Lawson, gets a little goofy because our brains don't work as well when our bodies are under attack. Metabolic imbalances, head injuries, hypoxia, stroke, kidney or liver failure, seizures, brain tumors, all of these conditions that we think about, because we'll say physical health and mental health like if they're two different things. They're really not. And so all of these can impact the other. Next slide, please, Simon. I'm trying to go through these slides quickly so that the information is out there, and then we can talk about the really important thing, which is what do we do with information? How do we take information and have it lead to changes in behavior? That's what this is really about. It's not about me just telling you all a bunch of stuff. It's really about all of us talking together about how do we move differently as a community, as individuals, so that overall we're improving our mental health and our overall health. So, common medications that can lead to mental health issues. We don't often think, and sometimes, the doctor people don't really tell us about the link between the stuff they're giving us for something that's going on that's causing us to hurt or causing us to not move as well, and how our brain is going to work when we take these medications. Steroids are really a big one because we use steroids for almost everything. They are wonderful. If your knee hurts, we're going to give you a shot of steroids. If you can't breathe real well, we're going to give you some steroids. So a lot of uses, good uses for steroids. At the same time, and I'll talk a little bit more about this later, they can be a real challenge for your brain to keep doing what your brain needs to do when you're either starting steroids or stopping steroids. Um, Beta blockers, hormonal birth control interventions, certain antibiotics, anti-seizure drugs that are used for other conditions other than just to stop seizures. Um, Pain relievers, acid reflux medications, a lot of these different medications that you may not think have anything to do with your mental health can really impact it. Allergy drugs, acne medications, and even, yes, that's not a typo, antidepressants. Antidepressants can, anyway, I'll talk more about those later. And then the other thing is you may have been taking a medication and you're doing really, really well. And then your doctor decides to change your medication or increase the medication or decrease the medication dose or stop the medication. Any of those can have an impact on your mental health. Next slide, please, Simon. Now, especially high risk but common drugs, right? So it's not like there's some weird thing that you've never heard of and you're never going to get prescribed to you. These are things that get prescribed all the time. I mentioned corticosteroids. Steroid shots in your knee or in your back can be wonderful when you're trying to move around. They're used for inflammation, for autoimmune disorders, but they can cause euphoria, they can cause depression, they can cause mania. That's a really big one with steroids. They can cause hallucinations, they can cause suicidal thoughts. They basically can kind of bounce your mood up and down, and it's uncomfortable when you're not in control of how you feel. Very uncomfortable. Um, there are there's increased depression with many different kinds of drugs, beta blockers, the birth control pills I talked about earlier, and hormone replacement therapy. If someone has gotten to that age, and it varies from person to person, where they're looking at hormone replacement therapy for menopause. So this list is a very long list, and one of the reasons that I don't have the other 17,000 medications on here that can impact your mood is because I didn't want to type the other 17,000 medications, but there are a lot of them. Um, just understand that almost anything your doctor is prescribing for you, you should understand what the potential is for it to impact your mental health. Pain medications are notorious for impacting mental health. Next slide, please, Simon. Okay, substance abuse and mental health issues. We could spend another 2 or 3 sessions just talking about this. But the part of it I want to talk about is how substance use in young people can lead to long-term mental health issues later. It's not something that's talked about enough because you can impact your long-term. Our bodies are indeed fearfully and wonderfully made, and they try to do what they're supposed to do. They really do. But when we start putting a lot of different substances into our bodies, especially when we're young, we can mess stuff up. We can have long-term neurotransmitter deficits that can lead to depression and anxiety. Chronic drug abuse in youth can also impact their normal socialization. I don't think I'm the only one that has been moving, either walking down the street or driving down the street, and seen somebody who is clearly not interacting with the environment around them. I saw some guys one time sitting on the street corner in DC, and they were just sitting there, and their heads were just bobbing up and down. There was no reason that I could see for their heads to be bobbing up and down. There were no earbuds or earphones. There was no music playing. They were clearly in some altered location psychologically. So whatever their socialization was that they could have been doing, interacting with people, talking with people, they weren't getting that. And so this whole issue with substance use, well, and I mentioned it earlier, well, I'm gonna get high, but then I'm gonna be okay tomorrow. I'm gonna get drunk, I'm gonna party, but then I'm gonna be okay tomorrow. It's not it's not always true that when you do something now and you do it every now as opposed to every now and then, but you're doing it 4 days a week, 5 days a week, you do it in the morning, doing it in the afternoon, that is a problem. And it can have long-term mental health effect. It is a factor behind mental health issues that people have as younger adults and then as less young adults. Next one, please, Simon. Drugs often used recreationally or illicitly. Okay, stimulants. Stimulants can literally make you crazy. They can lead to psychosis. And it's important to know that I'm just not going to be able to stay up and do my term paper or get my book report done in school if I take a bunch of stimulants. They can actually mess up your brain. Hallucinogens, obviously, it's called a hallucinogen. For crying out loud, it's going to make you see things or feel things or hear things that aren't really there. So it's called a hallucinogen. Just let people know that sometimes the whole explanation is in the name. It's a hallucinogen. That's it, period. Now, cannabis is something that is really different, right? I remember years ago, folks would say how marijuana is not a problem. I'm gonna get high. And I have a friend now that I knew in high school who he would smoke a joint on Saturdays, and that was it. He smoked one joint on Saturday, kind of washed the week away and relax. He's about 117 years old now, just same age I am. He still smokes one joint on Saturdays, right? And he's perfect. Graduated from college, master's degree, great job, married for decades, adult children. His life is great, but he's smoking what I would call old weed. Okay, if you have anyone who buys marijuana now and it's not from a dispensary directly to them, you don't know what's in it. You just don't. And so we have to be very clear with folks that I'm not trying to be the marijuana police. I'm trying to make sure that you understand that it is a fact that people put stuff in marijuana now, and you can get some stuff that you had not planned and that you can't control and you can't predict what it's going to do to you. So your mental health issues can easily come from getting some stuff that you thought. I had a guy say, well, I only get my drugs from my brother. I said, where does your brother get him? He has a guy. I'm like, okay, you know what? that's not okay. So I can't say it strongly enough because I meet young people who have, and it may only be one time, who get some bad stuff one time and their brain is just not the same anymore. So help people understand that whatever you think you are using, you may not be using it and it may kill you or it may damage your brain long term. So opioids and sedatives can be associated with psychosis. Oh, I wasn't ready yet, Simon. Now, either that means that I'm not clear or that you are so bored, you're trying to get me to run through these quickly. I got you, Simon. I know where you live. I'm gonna come over there. So anyway, cocaine, MDMA, and others can trigger psychotic episodes, really can trigger psychotic episodes where you are doing things you wouldn't normally do. I don't know if many of us may have seen the on television or on social media a couple of days ago. I think what's his name? Little Nas X, the guy that did the song "Take My Horse to the Old Town Road." There was a video of him walking down Ventura Boulevard in Southern California with nothing on but some little white briefs and some white cowboy boots. And it was, I don't know if that's what he wanted people to see about him, but it wasn't a good look for him and just not. Anyway, you don't know what you're taking, don't take anything. Okay, Simon, next slide, please. One of the challenges with mental health issues is that, let's say you do everything right. You go to the doctor because you're feeling depressed, you're feeling anxious, you're just feeling uncomfortable. And the doctor says, you know what? This is your diagnosis, and I'm going to give you some medication, right? That's where you really have to know that you and your doctor can communicate about stuff, right? I tell folks, I tell every patient I see, I tell them, I don't like absolutes, but here's a bunch of absolutes for you. Anytime, every time, any doctor ever prescribes any medication for you, always understand why the doctor is prescribing it. Look it up so you can read the long list that every medication has about the potential side effects. Always find out from your doctor what the doctor or your practitioner expects the medication to do, and how will you know that the medication is doing what you want it to do? Is that enough absolutes, Dr. Maxey? Because if you don't do that every single time, then a lot of times people who are prescribed medications will stop taking the medications. And I tell folks, I don't believe in doctor's orders. I just don't. I believe in doctor's agreements. If you and I can't have a conversation and you agree with me about what I'm prescribing, why I'm prescribing it, how you're going to know it's working, all that kind of stuff, if we don't have that agreement, then there is going to be a potential problem because mental health medications come with a requirement that you sort of weigh the pluses and minuses, the risks and the benefits, right? Some medications can potentially, in some people, cause sexual dysfunction. A really big issue is weight gain. For some people, some medications can cause significant weight gain. I don't mean like 10 pounds, I mean like 30 pounds. And that can cause other health issues, right? Some people talk about feeling emotionally numb. I can't, nothing impacts me anymore. I don't feel depressed anymore, but I just feel numb. That's no fun. And so being able to go back to your doctor and talk to your doctor or your practitioner and say, this is what I'm experiencing, it makes a big difference. And then if you're going to stop taking medicine you've been taking for a while, um, let your doctor know so that you can taper off the medication. Whether the doctor thinks it's a good idea or not, they should be able to tell you how to taper off the medication so that you don't wind up with a really challenging case of anxiety or insomnia or mood instability. And though I've heard a lot of people tell me they have brain zaps, I don't know what that is because I've never experienced a brain zap. I can tell you that they're not making it up. They have brain zaps and they don't like it. It is and I'm guessing it's exactly what it sounds like. I don't want to have it. I don't want you to have it. So always talk with your doctor about being available for this withdrawal when you're going to change medications. And then other things that are maybe less intrusive, but still not unusual. Dry mouth is a potential side effect of some of the medications that may be helping your mood, may be helping your anxiety, but are causing these other side effects. Excessive sweating, that's no fun. Fatigue, and then here's my favorite. Insomnia means I can't sleep. Sleepiness means I'm sleepy. And it always is interesting to me that these medications, many of them will have may cause sleepiness, may cause insomnia, may cause weight loss, may cause weight gain. Same medicine, same label. So we have to make sure that we are interacting with our prescriber, our practitioner, because how the med I tell my patients, I say, I will defend to the death your right to be an individual. And though the other 100 people I prescribed this to said it makes them sleepy, if you're telling me it keeps you up at night, I respect that. And let's talk about how we can make sure that things will help what we're trying to help and not have you. Because we talked a few slides ago, we talked about how insomnia is bad for your mental health. So while I'm maybe fixing your depression, I'm causing you a lot of mental stress because you can't get a good night's sleep. So again, this is important because you want to be able to talk with your practitioner. And before Dr. Gibson comes over and beats me up, your pharmacist is a good resource for some of these questions about what the medications may do or may not do. They're not going to usually give you medical advice for you and what you should or shouldn't take, but they actually may be able to help you with things to expect and things to not worry about so much. So enough said about that. Next slide, please, Simon. Okay. The other thing about mental health medication, remember I said earlier that this whole thing about mental health and physical health was just really somebody taking a bad shortcut? There, you don't separate mental health and physical health. And so there are mental health medications that can um, put you at higher risk for coronary artery disease, cardiovascular mortality, and diabetes. And then for some people, you may have a reduced risk of high blood pressure and diabetes, depending on how that particular medication is impacting your particular physiology. So again, it's nice to have your cousin tell you that they read something on social media that you need to do. At the same time, having a practitioner, someone that knows you, knows your health history, and has been trained to help you navigate whatever's going on is really important because there is no real line between mental health and your overall health. Uh, Next slide, please, Simon. Uh, Simon, can we go to the next one? Uh, One, you went up and back.
I think that's the last one.
Is that the last one? Give me a second here. Then, okay, good. We got through it. I was hoping that we would get through it in time for us to have some conversation. Thank you. Um, I wanted to make sure that we did get through it, and I'm glad we did, because it's important for us to have some conversation, and it's really important for me to have Dr. Lawson tell me all the things that I got wrong and just plain didn't get. So since our senior psychiatrist is on, I'd love to have Dr. Lawson make some additional comments if he's willing to do so.
And undo.
Oh, you were unmuted. There you go. Okay. All right. There we go. Go ahead, Dr. Lawson.
Okay, I just want to say that this again demonstrates this Renaissance man that we had before us, who could run a Department of Health as a psychiatrist, because of that firewall between physical health and mental health that we often create. And I think his very excellent presentation and demonstrated again the importance of considering the physical health issues and mental health issues. Just a few quick points I just want to note. My own career started out as a psychobiologist, in which I was looking at the role of physical factors in terms of mental health. So for me, what he was saying made a lot of good sense. The just and I just want to make the point that one thing he didn't emphasize is that these physical things produce changes in the brain. One of the
Mhm.
biggest physical things is our environment. We begin to aware of polluting factors. My colleague Carl Bell, deceased, often made the point that if you look at heavy metals and pollens in the environment, you find those cities that that's the case. You find high rates of community violence, high rates of homicides, so on and so on. And this is very well documented and somehow gets pushed to the side. Also, there's a very important physical stimulus that is, he mentioned role of cortisol. Our body has that as an endogenous agent. And we demonstrated some time ago, repeatedly, that if you look at the brain of people on the chronic stress, PTSD, and so forth, that the hippocampus is in fact smaller. It's impacted by chronic stressors in the environment. And then I just want to emphasize that we talk about personality disorders, severe mental illness, especially in our community. Severe mental illness simply is not diagnosed. We found 25% of people in primary care clinics have schizophrenia. I mean, we're not talking about folks talking to themselves in this corner. We're talking about people with chronic hallucinations, delusions, the full balance. And many times I really sympathize with my primary care colleagues in terms of how do you manage and work with these, especially when they think that when you give them the hypertensive medication, you're poisoning them. So this is a really important issue. And the one that I've been pushing for a long time is bipolar disorder. We recognize that there's two kinds of bipolar disorder, bipolar 1, where folks literally go crazy, and bipolar 2, in which folks give do never develop a frank manic episode, but their moods are unstable. And they can very quickly, under the right circumstances or the wrong circumstances, go from living normally to having was very much almost like a psychotic episode. And these are the folks that you give them marijuana. I don't mean the marijuana, the super high dose marijuana. I mean, that's regular marijuana. They'll go crazy. And these are also the folks that can never have their money managed properly, will spend much of their time homeless, even though they're very functioning people, because of these bipolar swings. And I had one guy ended up turning to be bipolar 1, but he one night he just told his wife that she had to go and he was going to kill her. Fortunately, we got him diagnosed and treated, and he didn't end up in the electric chair or some other situation like many of our people did. And then I just want to really emphasize the importance of looking at our standard routine medications that was noted by Dr. Walks, and just want to know one that's heavily used now is one called Narcan, naltrexone. And we've not just used it to keep, even though we encourage it to keep people from overdosing, but we also use it as an important ingredient in terms of weight loss. It's a common ingredient in weight loss, and one of the side effects is that it can cause depression and severe depression and suicidal depression. So it's an important, useful medication, but we got to watch out for it. And then in terms of suicides, just want to note that I've often talked to my internal medicine colleagues about interferon. I had a patient who was on interferon who'd come up to me and said, "Doctor, I don't want to kill myself, but I just got this urge to just do it." One of its known side effects, and some of our antidepressant medication. There's a usual controversy, folks going to court about this, about whether or not especially the older SSRIs will make you suicidal, but sometimes they do, as well as, of course, precipitating a manic episode in someone who is unrecognized manic depressive illness. So I just want to note that Dr. Walks hit a number of key elements. The important thing is not only this link between the overlap between physical illness and mental illness, but also many of the things that happen in our life, many routine things, can contribute to severe mental problems that can be persisting. The whole early adverse event thing is well documented in terms of how negative experiences in early childhood can lead to a lifetime of distress and increased risk of cancer and other lethal illnesses in your 70s and 80s. So again, thank you, Dr. Marks.
Let me just follow up, Dr. Lawson. Thank you for all of those very important additions to this presentation today. I really appreciate you being here. I wanted one area that neither one of us touched on is the whole spirituality and its impact with mental health issues. Dr. Maxey and I talk every Sunday about what row we sat on, and I had the honor of going to church with Dr. Maxey once back when I was in LA. I have a very good friend who is a practicing Jew, and every one of the Jewish holidays, he knows all about it. I'll send him a text. He'll send me a text. He'll try to involve my wife and I in some of the things. I have a very good friend I've known since I was a little kid who's a practicing Muslim. And there's something about having respect for someone's spiritual life, for someone's religious activities, customs, commitments, that can help that person feel like it's okay to talk to you and like it's okay to let you know when something is wrong. Because when someone is really, really serious about their faith and they have a mental illness come up or happen, it can be absolutely disorienting to know that I'm going to church, I'm going to temple, I'm going to mosque, I'm praying in the right direction, I'm doing a thing, and yet still I want to kill myself. That is, putting those two together can be so challenging for folks that I really want to emphasize that there is a place where a very strong spiritual life and a challenge with mental illness can come together and someone can get treatment and someone can get help. And we need to encourage people that it is not a disrespect to your prayer life if you see someone about how you're feeling and what you're feeling. So
Dr. Walker,
I hope I said that clearly, but it's so important that we have a wide opening to our tent when it comes to mental health and acknowledging and allowing people to come to us with some sort of mental health issue.
Dr. Walker, could you briefly review some of the major illnesses in mental health like psychosis, delusions, bipolar, etc.?
Why are you asking me? Why you didn't ask Dr. Lawson?
Because
Look,
you're the boss today.
I'm one of the things that I am really, I think kind of good at is using those third grade words and those $3 words. I found that the only person that was really impressed when I used all the big words and the big definitions was my mom. Not that she understood what I was talking about, but she really liked to hear me sounding really smart. I think that for me, when I talk about, you mentioned a few, I'll go with depression first. Depression is not just sadness. Depression is an overwhelming feeling of despair and hopelessness. And I think that's the difference. I can be sad about something. I can be really sad about something that is really sad, but I don't get that overwhelming feeling of hopelessness because depression tells you two lies. Depression tells you that whatever it is hopeless. Hopeless is an awful word, but depression tells you that it's hopeless. And then the second lie it tells you is that it's not going to get any better. And if something is hopeless and it's always going to feel that way, suicide kind of makes sense. It kind of makes sense because I can't live like that long term, right? So I think that's depression. Anxiety is a feeling of absolute disquiet in your life where, and I'm talking about, you mentioned major mental illnesses. A lot of us have some anxiety, we have some depression, but we kind of work our way through it. I mentioned earlier in the talk, coping skills. We have coping skills, one of them being other people that we can talk with that can kind of help shore us up sometimes when life seems to, be kind of letting us unravel a little bit. So, but anxiety is an absolutely uncomfortable place where I think the most precious thing on this planet is peace of mind. And when you don't have any peace of mind, really, really hard to do anything else. When there's an internal sense of disquiet and uncomfortableness that goes on. Another major mental illness is, we talk about psychosis, schizophrenia. That schizophrenia is a diagnosis that has to do with psychosis. But what you're really asking about is, what does it look like? It looks like someone who is not seeing or hearing the same things that we're seeing or hearing. And so to be very, very clear about it, it's my reality is different from your reality. That's that whole psychotic piece. And there's something that we do as part of an assessment, as part of a mental health assessment. And it's called reality testing, where we actually ask questions to try to understand whether your reality that you're experiencing is the same as my reality that I'm experiencing. And when it's not, that's a problem. The other thing, when I talked earlier about being able to notice when things are going on. I was in church today. There was a young man sitting next to me. I talked to him briefly after church, but I didn't get a chance to really connect with him. He was sitting there and he was on his cell phone. What's unusual about that? Nothing is unusual about that. Young people are on their cell phone all the time in church, during the choir singing, during the pastor preaching, whatever. But he had music playing on his cell phone. And he didn't have earphones or headphones or earbuds. So, but he had it turned down really low. But I could hear it sitting next to him. And somebody sitting in front turned around one time and looked at him because he had the music playing. And I recognized, I think, because I didn't talk to him, that he was very uncomfortable. He wanted to be in church. I think he felt he needed to be in church, but he needed some additional stimulation. And music works well for a lot of people that have psychosis because it interrupts whatever's going on in their brain. It can drown it out for some people, but it can interrupt it. So I think to go through the three major issues, depression is something that is overwhelming and hopeless. Anxiety is something that won't let you be comfortable. And then psychosis is something that makes you experience a reality that no one else is experiencing. And while I'm talking about it, I talked to a pastor this week, Dr. Maxey, and this is very important. Sometimes we like to have rules, right? And one of the rules is you can die from diabetes and go to heaven, but you can't die from suicide and go to heaven. That's a bad rule. I don't think that, because what it does is it sets us up to think that the depression, the overwhelming depression that is just as deadly as an astrocytoma, as a kind of brain cancer, that overwhelming depression can be just as deadly. And I think that if people don't get help or don't get the right kind of help and aren't able to find effective help for them, we have to respect that it's a deadly disease. And you can't just say, come on, get up out that bed and just, do what you're supposed to do. We don't say that to people that just had a heart attack. We don't say that to people that have an overwhelming mental condition. An overwhelming medical condition that we respect as an appropriate illness to have. So I want to put that on the table. It is such an important part. I mentioned early on one of the first slides about stigma, and it is really hard in our community still for people to deal with the stigma. And when you combine the stigma with the fact that the resources aren't available in many of our communities, it's tough.
And the final question, how would you describe a delusion?
Well, a delusion, if you look it up in the dictionary, I think it still reads, it's a fixed false belief. It's something that, if I think that there's somebody trying to break into my house, but I look out the window and it was a wind, there was a branch that brushed against the house. But you talked earlier about, Dr. Maxey, about a patient that had fixed false beliefs about people following her and that kind of thing. And I think when you and I talked about this earlier, I said that a mental illness basis for a delusion should be a diagnosis of exclusion, right? So you should work up all the other things that Dr. Lawson talked about and that I talked about, and make sure this is not somebody with a urinary tract infection that you could just treat and they would be better, right? All that stuff would go away. This is not somebody who has some other sort of hypoxia from a general. There are so many things that can impact us and have our brain seeing or hearing or believing things that aren't seen or heard or believed by the people around. So yeah, a delusion is basically a fixed false belief.
Thank you so much. We're at the top of the hour, but let's see if there are any questions in the chat, Dr. Neighbor Stevens.
No, there are no questions.
Yes, I overwhelmed them. You got nothing to say.
No, there are comments. There are
Yeah.
no questions.
I just want to add one quick point while we're going, but the delusion is also determined by culture. And
Yes.
that is that someone who goes by and say they believe in Santa Claus in this culture is okay. And used to work with Dr. Francis Welsing, who often made this point that with too many times folks were considered delusional when in fact they were responding to things such as racism and so forth. And I used to work at St. Elizabeth's, the pastoral service, trying to distinguish among people. You can have a mental disorder and also be spiritually inclined. You
Yeah.
can have delusions and also believe in God. And yet, there are some cultures which belief in God is considered a delusion. So it's not a philosophical issue. It's a very important one in terms
Right.
of whether or not a person should be treated or should the person be supported and worked with.
I'm sorry
Mhm.
for Santa Claus, though.
Get off Santa Claus, Dr. Maxey. He didn't do nothing to you. Get off Santa Claus.
Well, why don't we have our final comments for today, Dr. Lawson?
Just want to note that there are some two disorders that Dr. that the ones that mentioned. Mania um, is often not recognized because people who are hypomanic do things that we like. They have lots of girlfriends, they gamble like crazy, and they go out and work like crazy. And mentioned that especially if people with Parkinson's disease on some of the medications will send you to the casinos in a second. And also panic disorder is
Mm.
often seen in primary care and emergency rooms. Panic attacks are often misdiagnosed as cardiovascular problems.
Yeah.
Unfortunately, the only real way to rule it out is to go out and get an EKG or work the person up. But it is an extremely, very, very treatable, but very, very frightening experience and is extremely common.
Thank you so much. Speaker Dr. Walter, first of all, I appreciate everything that you've taught us today and appreciate the review that you've given us, but I'd love it to have some final remarks.
So I want to go back to something that you asked about and Dr. Lawson talked about this cultural impact when it comes to delusions. I see Dr. Lisa Kerman Dawes is here, and I apologize because I was in Jamaica a couple of days ago, but didn't have a lot of time. I was in and out. I went to see my brother, and I was in Ocho Rios, and my family background is West Indian, right? So I remember when my Aunt Maud died. Aunt Maud was like 90, I don't know, 95, 97 years old. And she took care of me a lot when I was in college. She cooked for me. I stayed at her house when I was going to USC, all of that. And to this day, I believe that when Aunt Maud died, she came by and I saw her and away she went. Now, is that a delusion? In America, it is. I'm not sure it's a delusion everywhere in Jamaica, and it's not a delusion everywhere in Guyana. So I just want to say that because we live in such a diverse world, um, y'all just please tolerate me having my belief about Aunt Maud coming to say goodbye when she was on her way out, and I'll tolerate your belief about anything that doesn't impact you in a negative way, maybe makes you feel a little bit better. I felt pretty good that Aunt Maud came by on her way out, right? So I just think that accepting the amazing diversity that we see in the world is an important part of all of us being a little bit healthier. And I had some good food in Ocho Rios, Dr. Lisa Kervin Dawes. Met some good people, had some good food. So I'm coming back soon.
Thank you.
Good day, everyone.
That's Barbara Davis Stevens.
Well, I am certainly grateful for this tour that you took us through, Dr. Walks, and I hope that people take advantage of this from the library because you have a lot of very good information packed into a very succinct package. I hope that we will discuss Alzheimer's and dementia again, because as we have a society that is growing older, family members need to be aware of signs and symptoms of conditions present that need attention. And I personally have been guilty of not ignoring, but thinking that what I was observing was benign.
Mm.
And I think we need to talk a lot more about dementia and Alzheimer's in particular, because generally it's the family that identifies the problem and takes the person to the doctor. I mean, not always. So we need, I'm an action-oriented person. So we need to provide the information so people can be prepared to deal with situations in their families or
Amen.
friends.
Thank you so much, Dr. Barbara Davis-Sebon. And again, my final comment is to give kudos to Dr. Walk for a wonderful presentation today. And we'll look for you back as soon as possible, given other parts of mental health, along with Dr. Lawson. Thanks, everybody. Simon, thank you very much. Have a great day.
Bye.
Everyone.